Dentistry is a balance of art, science, and business. This is beautifully quoted by Dr. Jeffrey Hoos. In dental colleges, we are definitely taught about art, science, 100%, but business, I don't know why it comes as a question when we talk about business in our dental or medical or the doctor's field. I know our primary duty, the oath we take, is about serving, of course. But business is a small amount or the right amount you take for the service or the product you offer to your audience or to the people you are talking to or serving to. So why businesses look like that? Of course, we are not doing any corruption. If something is for 5 rupees, we can sell it or give it for 10, 15, 20. But we are not doing 5 to 500 or we are not doing rupees 5 to 100. And of course, there is a complete difference between a brand and a copy. Of course. Hey guys, welcome back to your channel, Dr. Batisi, and I'm your dentist, Dr. Jasmine. These things, the clinical tips we will be sharing, are usually learned over the period of time. So let's quickly get down to the tip number one. And these are not taught. The first one is, guys, be on time. Whatever appointment you have given, for example, it is for 4 o'clock, 4 p.m., be there 4 p.m. You don't have to worry about if the patient has come, if the patient is late, because then the patient has to suffer. The shorter the appointments, the number of times increases that the patient has to come. So you always be on time. I cannot understand why the doctor is late, is taken or seen as something good or something to be proud of. Always be on time. It's a sign of care for your patient. It's a sign of sincerity that as a doctor we are very professional and we must see to it that we do it. And also it shows that we also have a life beyond dentistry. Dentistry is a part of life. It's not life and cannot be life. Of course we are devoted to it, but it cannot be life. Life is much more to it. The two is, guys, greet the patients. Of course, whenever you first see the patient, remember the name, because there is a book called How to Win Friends and Influence People, written by Dale Carnegie. And it's an amazing book. Link is in the bio, and you must heard that our name is the sweetest thing to our ears. So always greet the patients, remember their name, say good morning, good afternoon, good evening, hello, whatever you want to do. And remember few specific things about them. Suppose you are doing a consultation, the first visit of the patient. You come to know he has a brother, sister, it's his birthday, or he's studying in 10th class, 12th class, boards are coming up. So on the next appointments, just be like, how is your board exams going or how is your exams going. Remember small things, or at least note it down somewhere, because when you open that page again in the later appointments, it builds a bond of trust and connection among the dentist and the patient. Guys, third is hair inside, especially for the girls. I know this, but I have been once in the Acharya Bhikshu Government Hospital and once in a private clinic. Twice it has happened. I will make sure it doesn't happen one more time. You have to tie your hair always. Actually, what happened, my aprons, first two buttons were, just off. So even if I put the hair inside and everything, it used to come out after like few minutes. So that was the thing, but keep the hair inside, of course, after corona thing. And of course now there are caps available, beautiful printed solid color customized caps that you can of course go and buy, and reusable, disposable. It's like you just wash them and you can use it again. And it's no like that blue and green color cap that we used to wear. It's now more cooler and funky. Guys, fourth one is take pre and post treatment pictures. It's for to see your progress, how you used to do the treatment earlier and now, the change you have, the growth you have got into, and as a record, also as a patient education, to see like, of course, this was the size of the abscess, and after 6 months, 3 months, 1 year, this is how it looks like. And it's also amazing to see the results, because it's dentistry is magic at the end. So guys, the fifth one is quadrant, we must remember that when a patient comes, first look into the chief complaint always, and then go quadrant wise. First, see the first quadrant, tell the patient that I'm just seeing your oral cavity as a checkup. So move from first to second to third and fourth. You can either go first, write it down, and then tell the patient, or while you are going the first, you can say, okay, this teeth has a cavity, this is missing, this caries is not there, but it can be, it's tricky there. If you do not clean, keep the hygiene maintained, it can cause caries. So like that, but go from first quadrant 2, 3 and 4. And of course, when you do scaling or some treatment, especially in scaling, suppose you are doing the mandibular jaw, go from one area to another. I used to do it like, and I learned this from a dental assistant, guys. He said, ma'am, why are you doing random scaling, like sometimes in the fourth quadrant, sometimes in the, if I said see some spots or some plaque in the second quadrant, I used to do it there. It was not in the college because I guess we follow a particular protocol there and it becomes into a habit. But afterwards, I don't know how come, but I was like doing random. So he said ki just move from one area to another. And also I learned this from a senior of mine, and while I was an intern, I guess, or in the final year. So yeah, and it was the OMDR department. So always go from one quadrant to another and don't do just this random. It messes with up you, and also it's little confusing for everybody. Mixing materials, learning how to get the best of it, meaning we have brought everything, but we must know in what cavity how much material should go in and how much we should mix. That should be learned. That is why we should mix on our own, and that is why we should conserve material also. And it's learned from the second year of your BDS, and that is why teachers are so, of course they have to save the material. And of course there are many things, because dental material is not like cheap. So we must know how to preserve the materials, how to get the best use of them in the dental setup, because that's really important. Guys, the sixth is follow up. Always after you have done the treatment, no matter how old in the sense how frequent your that patient is to you, always do a follow up. No matter what age, no matter how many appointments has the patient done, within 3 days of the treatment, always do a follow-up. Ideally it should be 24 hours after one day. So it depends upon you, but always do a follow-up. It's like a care, it's like, are you okay? It's like, it's not just ki treatment kara, paise liye and it's done and over. It's like showing care. We still care, we are still there for you. It's like that gesture. The seventh, guys, is treatment charges are different for everybody. Of course we have a basic fixed rates, but let them let the patient decide their own budget, but give them all the options available at your clinic currently, because there are different types of clinics. You can't compare any clinic at all. So whatever your clinic is, wherever you are working, whatever options are available in that clinic, just give them all the options, and let the patient decide the budget. This also I learned from a senior of mine while we were talking about patients on, I think, Instagram, and Instagram ID is dr.batisi. So think like a patient. Guys, if I was a patient, I would like to know the options and I would like to choose it on my own. Of course, whatever the doctor suggests, I will keep in mind, but choice should be mine at the end. The eighth, guys, is system of the clinic. Like there is a system of the college, like if we are a dental student, we know that we have to do this entry, we have to do this, and then take the patient there, do the treatment, show it to the seniors or the staff, and then fill in the entries or the record books. There is a system. There is a system for every clinic, and no system can be exactly same, because something works for some clinics, something doesn't work, because of the people, because of the atmosphere, because of the location of the clinic, because of the state. Everything varies. No matter if there are two clinics simultaneously, both will have a different system, because dentists are different, everything, work environment is different. So that is one thing, that system should work for you no matter what system you put in practice into your clinic. And always be flexible with the payments, guys. Give the patient a lot of payment options digitally. Card, if it's a new clinic, if you don't want to do card, it's totally okay. As I said, it's your clinic, you have to be okay with it. Then make sure you have other options, like you have check, you have bank transfer, you have cash if you are okay with it. So that is how you must do it. Also, guys, now the ninth is keep upgrading. Go to conferences, get the CDE points. It's beneficial regarding your upgradation of when you once you have registered in the council of your state, then to upgrade it after the 5 years, I guess. And the materials, try new technologies, try new treatments. If you're on level 0, go to 1. If you're on 1, go to 2. But don't compare your 10 level with another's 50, because we should not do that. Just go a little above, upgrade, be better than you were yesterday in your own clinic, in your own practice. Never compare, please, because everything is so different. We compare things that are similar on the basic ground level, but we can't compare such things. Also, guys, training of the assistant is so important. Are the backbone of your clinic, and their training, energy to be put up in training them, because they don't know anything of dentistry. So, and if they don't have a doctor or the medical background, or if they haven't worked, it's their first time in the dental clinic, it becomes a little more cumbersome, because I have done that when I was leaving a clinic. Before that, there was an assistant that joined, and I have to tell him everything, because till that time I was the assistant, I was the dentist, I was the receptionist, I was doing everything. So I made sure that I tried my best, and it's a little difficult because of course it's new. It's like in the BDS first year, second year, everything is so new and so challenging for us. It's the same way for them, so have patience with them. Now, guys, the 10th is be honest. Mistakes will be done. Out of 100 patients, maybe 60, 70, 80 are with you, and 10, 20 feels you are not good enough or do not want to come back to you, and it's all okay. And mistakes will be made, like you might break a file or something, which is not exactly a mistake, but we should make sure that we aspirate, for example, before giving LA in the two directions, in the two ways. So but yeah, like mistakes, or we can say few things will be done in the other way. Either we learn to manage it, and at the end it's okay. And when you do that, be honest with the patient, because when you're honest, we somehow feel connected, and the person we are talking to understands us. That is the beauty of honesty. And there is a message, guys, do not degrade dentistry by saying this dentist ye aapne kahan se karwaya hai, where you have got this work done, it's so horrible, or that dentist has diagnosed wrong or anything. Just say that now that you have come to the clinic, I'm here, I will try the best to my ability to make sure that this doesn't degrade, and this gets better and better and cured or treated at the end. But do not degrade, saying that you never know who is a quack, who is a dentist, and you never know who is going to say all those things about you if your patient goes to another clinic after you also. So never do that. So guys, happy practicing, happy serving, and see you in another video. Stay safe, take care, bye bye.